Have you noticed your cat acting differently lately? Cats are experts at hiding when they're sick. So even small changes in their behavior can be a big clue that something's wrong. As a cat owner, it's important to pay close attention to the little details, because early signs of illness can be easy to miss. One of the first things to look out for is a change in eating or drinking habits. If your cat suddenly stops eating or seems disinterested in food, it could be a sign of dental pain, digestive issues, or even something more serious like kidney disease. On the other hand, if your cat starts eating way more than usual, it could indicate hypothyroidism or diabetes. Drinking too much or too little water is also a red flag. If your cat is drinking excessively, it might be a sign of kidney problems, while drinking too little can lead to dehydration. A good way to check is to gently pinch the skin on the back of your cat's neck. If it doesn't snap back into place right away, your cat might be dehydrated. You can encourage hydration by offering wet food or adding a little water to their meals. If they refuse food or water for more than 24 hours, it's time to see a vet. Another major sign to watch for is changes in energy levels. If your normally playful cat is suddenly sleeping all day and ignoring their toys, they might not be feeling well. Lethargy can be a symptom of anything from a minor infection to something more serious like anemia or organ issues. On the flip side, if your cat becomes unusually hyper or restless, it could be linked to thyroid issues or anxiety. Pay close attention to their bathroom habits too. If your cat starts avoiding the litter box, straining to urinate, or having diarrhea, these can all indicate problems like urinary tract infections, kidney disease, or digestive disorders. Constipation can also be painful for cats, and you might notice them straining without much success. A simple home remedy for mild constipation is adding a small amount of pumpkin puree to their food. It's full of fiber and can help get things moving. But if your cat is struggling to go to the bathroom for more than 2 days, or if they're crying out in pain, they need medical attention right away. Coughing, sneezing, or excessive grooming can also be signs that something's wrong. A few sneezes here and there aren't usually a big deal, but if your cat has a persistent cough or runny nose, they could have an upper respiratory infection. Mild cases can sometimes be helped with a little steam therapy. Just bring them into the bathroom while you take a hot shower to help loosen up congestion. If they're grooming one area too much, check for signs of skin irritation, fleas, or allergies. Some over-the-counter treatments like flea combs or hypoallergenic wipes can help with minor skin issues, but if the irritation continues, a vet visit is necessary. Another thing to watch for is sudden weight loss or gain. If your cat is losing weight rapidly despite eating normally, it could indicate a serious condition like diabetes, hypothyroidism, or cancer. Unexplained weight gain, especially if they seem bloated or uncomfortable, could mean fluid buildup, which is often linked to heart or liver disease. Weight changes should always be taken seriously and checked by a vet. Changes in behavior are also a big indicator of illness. If your affectionate cat suddenly becomes withdrawn or aggressive, or if they start hiding more than usual, it might mean they're in pain or feeling unwell. Cats don't usually vocalize their pain the way humans do, so these subtle shifts in behavior are their way of showing discomfort. If they're constantly meowing or crying out, especially while using the litter box or being touched, it's a sign that something isn't right. For mild digestive upset, you can try a bland diet boiled chicken and plain rice in small amounts. Can sometimes help settle their stomach. Probiotics designed for cats can also aid digestion and support gut health. If your cat is vomiting repeatedly though, especially if it's paired with lethargy or refusing food, it's best to consult a vet. Flea and parasite prevention is another important part of keeping your cat healthy. If your cat is scratching excessively or has small black specks in their fur, they might have fleas. Over-the-counter flea treatments like spot-on solutions or flea collars can help, but always make sure they're safe for cats. Some dog flea treatments can be toxic. Regular grooming and using a flea comb can also help keep parasites under control. One of the most dangerous but subtle signs of illness in cats is difficulty breathing. If your cat is breathing rapidly, wheezing, or struggling to catch their breath, this is an emergency situation. Respiratory issues can be caused by asthma, infections, or even fluid buildup in the lungs. If you ever notice your cat breathing with an open mouth or panting excessively, don't wait, get them to a vet immediately. Cats rely on their owners to notice when something is wrong. And being aware of these signs can make all the difference. The sooner you catch a health issue, the better the chances of successful treatment. While some minor issues can be managed at home with proper care and remedies, anything that persists or seems severe should always be checked by a vet. Regular checkups, a balanced diet, and a stress-free environment can go a long way in keeping your cat happy and healthy. Your cat may not be able to tell you when they're sick, but their body language and behavior can speak volumes. Stay observant, trust your instincts, and always prioritize their well-being.